Inflammation is a protective response of the body to injury. There are two types of inflammation. 1. Acute inflammation. 2. Chronic inflammation. Inflammation aims to 1. Remove the initial cause of cell injury. 2. Remove the necrotic cells and tissues resulting from the original insult. 3. Set into motion the events that eventually heal and repair the sites of injury.
What is acute inflammation? Acute inflammation is a rapid response of the body to injury, microbes and other foreign substances. It occurs over seconds, minutes, hours, and days. What are the clinical features of acute inflammation? 1. Redness. 2. Warmth. 3. Swelling. 4. Pain. 5. Loss of function. Causes of acute inflammation: infections, trauma, physical and chemical agents, ischemia and tissue necrosis, foreign bodies, immune reactions. Acute inflammation has two major components. 1. Vascular changes. 2. Cellular events. There are 4 vascular changes. 1. Transient vasoconstriction. 2. Vasodilatation. 3. Increase in vascular permeability. 4. Lymphatic response. 1. Transient vasoconstriction. Vasoconstriction is the body's defense against blood loss. It reduces blood flow to inflammation site. 2. Vasodilatation. It involves arterioles and causes locally increased blood flow. Then increase in blood flow causes an increase in the hydrostatic pressure within the blood vessel. The increased hydrostatic pressure pushes fluid out into the extracellular spaces. This is called as a transudate. Vasodilatation leads to stasis of blood in inflammatory site. 3. Increased vascular permeability. This allows for the movement of protein-rich fluid into the extracellular matrix. 4. Lymphatic response. In inflammation, the lymph flow is increased to help drain the edema fluid from the extracellular spaces. The lymphatics and draining lymph nodes may become secondarily inflamed. Inflamed lymphatics called as lymphangitis. Inflamed lymph node called as lymphadenitis. There are 5 cellular events. 1. Margination and rolling. 2. Firm adhesion to the endothelium. 3. Transmigration between endothelial cells. 4. Chemotaxis. 5. Phagocytosis. 1. Margination and rolling of leukocytes. Loss of intravascular fluid and increase in plasma viscosity causes slowing of flow at the site of acute inflammation. This allows neutrophils to flow near the endothelium. 2. Firm adhesion of leukocytes. Leukocytes adhere to the vascular endothelium at sites of acute inflammation. This occurs early in the acute inflammatory response. 3. Transmigration. Leukocytes migrate by active amoeboid movement through the walls of venules and small veins. 4. Chemotaxis. The movement of extravasated leukocytes along a chemical gradient towards sites of infection or injury is called chemotaxis. 5. Phagocytosis. This is the process whereby neutrophils and phagocytes ingest solid particles. Phagocytosis consists of 3 distinct but interrelated steps. 1. Opsonization. 2. Engulfment. 3. Killing and degradation.
The outcomes of acute inflammation. 1. Resolution. The complete restoration of the inflamed tissue back to a normal status. Occurs in situations where limited or short-lived inflammation has occurred. 2. Healing and fibrosis. Occurs when there is large amounts of tissue destruction. 3. Abscess formation. A cavity containing pus may be formed here. 4. Chronic inflammation. If the injurious agent persists, then chronic inflammation will ensue.